Kentucky's Nurse Appreciation Week is brought to you by Clark Regional Medical Center, a place where nurses love to work.
Welcome back to Midday Kentucky. There are several different types of nurses out there. So Sheree Mankin and Priscilla Coffey from Alliance Medical and Home Care are here to explain the difference between clinical nurses and non-clinical nurses. Thank you for being here, ladies.
No problem.
Now let's talk about, first of all, one of you is a clinical nurse, and that's
Yes.
Priscilla, right? Or Sheree, and then the non-clinical nurse. What is the difference between the two? Can you explain this for us?
Well, I basically make sure that everything the resident needs
Yeah.
as far as their assisted daily living, examples would be assisting them with a bath or
Okay.
perhaps taking them to the grocery store or just preparing a meal for them.
Okay.
That's what
in
I
their
do.
home. You go
That's
to
right.
their home and their location. Okay. And
Correct.
then what is your position like then?
For me, you would find me actually within the facilities. I would
Okay.
actually be on site, whereas Priscilla would more so go to maybe like home health or assisted living.
Gotcha.
But I'm going to be within the actual facilities on site.
Gotcha. And do your departments overlap each other? How does that work? Do you cross roads at some point during your day? How does that work?
Actually, we wouldn't
Yeah.
overlap at all unless, it comes to when the patient is actually going to be DC'd from the actual care.
Okay.
They're
What do you
like-
mean by that? Discontinued or?
yes.
Okay. All right. Gotcha. And so as far as like with the patient itself, do you ever have to get together to talk about the patient in particular, like little detail work, or how does that get communicated between the two of you?
Occasionally would. There might be something that nurses, of course, would have to share. But like she said, usually it's, if they're discharged and they may need some extra help at home,
Yeah.
that's where she would come in.
Gotcha.
Yeah.
So how is it that you can separate your work from your personal life? How does that work? It would be very difficult to just leave work at work. And when you get home, sometimes you have really good days, I'm sure, and then some days are really kind of tough. So how do you do that? How do you both do that?
Well, you have to learn to balance, and yes, having balance in that is very important. You have to learn to separate the two.
Yeah.
And, but, you have your good days,
Yeah.
but you balance it out and it all works out.
And what about you, Sheree?
Oh, for me, nursing never actually leaves my mind. I tend to go home and wonder like all the stuff that I maybe did not do during the day, so you're always thinking of those thoughts. But luckily with Alliance, we're flexible, we make our own schedules.
Yeah.
So I think for me, just taking time off to be at home with my family and kids.
And really enjoy
I
it.
do yoga on the side too. So
Do you? Well,
I
that
do.
helps. Yeah, I'm
so
sure.
that helps to de-stress.
I'm
but
sure it does.
Taking time off.
Yeah,
Yeah.
that's important. Time for yourself. So let's talk about also your patients. What can patients do to maybe make the nurse's job a little bit easier for you? Is there anything that that I could do as a patient?
Well, my job is to make sure the patient's needs are met. So,
Okay.
it's not about what they can do to make my job easier. It's about what I can do to make their life better.
And that is why you are a nurse. That
Yes,
is
ma'am.
so sweet. That is very giving.
Thank
And
you.
what about you, Sheree?
I felt the same exact way about
Yeah.
it. I don't ask my patients to change for me. I just try to build rapport with everybody that I meet, and just kind of connect on their level. It's not their responsibility to change to make me more comfortable. It's
Yeah.
like she said, we're caring for them.
How do you build that rapport so quickly? How do you do that as a nurse? Because I've seen this with my own mother when she had a hospice nurse coming in, and they were able to really connect with my mom quickly. How do you do that?
You just gotta care. You have a heart,
Yeah.
You either meant to do it or you just wasn't,
Wow.
And
Wow.
I think for me as well, I just try to envision that maybe that's one of my own family members, and
Yeah.
that seems to help a lot.
Oh, well, that's great. Well, thank you so much for everything that you all do. We really appreciate it. And coming up, we are looking at what's popping in entertainment. You're watching Midday Kentucky. Keep it right here.